Hello, I'm Roger Watson from the University of Hull, and in this session I'm going to talk about the STAR project. STAR stands for Supporting Transition and Retention of Newly Qualified Nurses, and I'm going to talk about a project that was funded by the Burdett Trust for Nursing over 3 years for £184,000. It was initially funded in 2016. We've only recently completed it. Obviously, there were some issues during the COVID-19 pandemic. So as I say, I'm Roger Watson. I was the principal investigator, and the rest of the team were Dr. Jane Ray and Dr. David Barrett. They were the co-principal investigators. Dr. Helen Gibson, our research assistant, and Joe Asplund, also our research assistant. The context of the study was essentially some of the problems in retaining newly qualified nurses in the workforce, particularly in the National Health Service in the United Kingdom. Nursing workforce shortages continue, and there's a lot of evidence that this exists and also that it has negative impacts on patient care outcomes. NQNs is the expression we'll use for newly qualified nurses. They're one group that's really at very high risk of early exit from the workforce. They report being overwhelmed and often unprepared for their roles. And the Health Education England, which is part of our National Health Service, thinks that supportive transition is key to retaining newly qualified nurses and reinforcing what they call the flaky bridge between education and practice. I have to say that the evidence for this is not particularly strong. Our project was designed to investigate this to some extent and to come up with a toolkit which could be used in future, and I'll describe the rest of the aims and objectives and what we actually did in the remainder of this presentation. The study aims were to establish the current state of the evidence base for nurse retention and transition from student to registered nurse, and to provide UK healthcare organisations, higher education institutions and individual nurses with an evidence-based approach to plan for successful transition. And this study was very much a collaboration between nursing students, newly qualified nurses, clinicians, academics, and also service users, in other words, patients. So we involved as many of these people as we could, not only in the project as people who were providing us with data, but also on the steering group for the project. The design was a mixed method study over 3 years, and it had 3 aspects to it. On the left, we carried out a rapid evidence assessment. In the middle, we gathered some quantitative data, and on the right-hand side, we gathered qualitative data. And what I'll do is describe the findings from each of these phases in the next few slides. So the rapid evidence assessment found 48 papers. You can see the breakdown of the papers there. The quantitative data were designed initially as pre and post-test. Really, we wanted to see if what we were doing had any influence on retention. And the qualitative data was through a wide net out, involving students, newly qualified nurses, people in universities and in clinical practice. And also we gathered information from the students' routine reflections prior to transition. We got 113 of these, and we interviewed 40 people. So first of all, the findings from the rapid evidence assessment. We found that most interventions most commonly preceptorship and mentorship. I won't dwell on the definitions of these two different kinds of support, but we found that most of them resulted in some level of benefit for students. What we suspect is that really the fact that something was being done was more important than what was actually being done. Strategies with a positive influence include having a formal orientation period, choosing the initial placement carefully, and being satisfied with where you're working and with your supervision. Also empowering people to make their own decisions when they go into clinical practice, and also having some employment before registration. However, only 6 of the 48 studies that we pulled down in the rapid evidence assessment directly addressed retention. They seemed to assume that improved retention would be an outcome of positive transition experience, but there was very little, in fact really no evidence to support this. And when formal or informal approaches to enhancing transition are in place, they do help to increase job satisfaction and possibly indirectly have a positive effect on retention. From the quantitative retention data, we compared 91 in the pre-group with 75 in the post-group, and the outcome was being still there 12 months after registering. In other words, 12 months into entering professional practice. Well, what we found was there was no significant relationship between the pro and the post-test group. In other words, there was no impact of what we were doing on retention. I'll tell you what we were doing later, but we were doing something. We were at least providing them with some resources, but we didn't find that it had any actual impact on the numbers. For both groups, most of them had stayed with the same employer and hadn't changed their role and didn't plan to do so in the immediate future. And most of the students that we engaged in the study had actually used the STAR project and its resources. And the group, the post group, the group that we looked at after the period of employment, after 12 months, had accessed the first place of employment opportunity, and only one reported not finding this useful. By this I mean that they were given the opportunity, while they were still students, to go and work for a while in the first place that they chose to be employed. And this is one thing that we think is useful, but we don't have any numerical evidence to back that up. Most of the evidence comes from the reflections by the students and from the qualitative data. Turning to the qualitative evidence, to the interviews, and the methods are described in detail in our report, which I'll give you a link to later. I don't want to dwell on the methods here. We found there's a range of experiences, but there was a sense of transition shock in the students. And this was usually based on their personal characteristics, whether they reported dealing well with stress or being generally confident. Having previous work experience or not had an influence. Generally, having previous work experience was a positive thing in their transition. And we also found that the culture in the organisations where they worked could be a barrier to transition, or it could be a facilitator. So we obviously tried to identify some of the things that were barriers and some of the things that were facilitators. We also found that managing expectations was key. Newly qualified nurses report feeling out of their depth or not good enough for the job that they're doing, and they need to be. This needs to be explained to them that this is not an unusual feeling. And employers need to be very clear with them on what they can expect from the organisation to support them and what is expected of them as newly qualified nurses. Just as an aside here, there is an expression in English called hitting the ground running, and it does seem to be the case that there's still a very large expectation from the National Health Service that newly qualified nurses should be able to hit the ground running. In other words, they should be able to enter the job and do everything that's expected of them without any further support or training. And we just know that this isn't the case. So by working together during the transition period, the ICHEIs, that's the university, the health education, the higher education institutes, can actually help to prepare students, and employers can better support them. So there's a need for some collaboration here between universities and clinical placements. From the student reflections, the things that they were looking forward to were financial benefits. They wanted to be paid. They wanted to get stuck in. This is another English expression. I mean, they wanted to get engaged with the job. They were looking forward to having more training and skills training available to them. They just wanted, finally, after all these years of education, to being a nurse and not being a student. And they were looking forward to the levels of independence and autonomy they would have in the job. But they weren't looking forward to being underprepared and out of their depth. This was a common theme which we've seen already in the interviews. They were a little bit afraid of the increased responsibility of being a nurse and in this new role. Again, that's related to confidence. They were nervous about whether they would be good enough. And these are all, again, reflecting this feeling of not being entirely confident in the transition. And also they were a little bit worried that they wouldn't have the speciality skills that might be needed, for example, medication management and giving intravenous fluids, which is not something that's done routinely in nurse education in the UK. Would they have access to a mentor or a preceptor was a worry to them. This didn't always work very well during their education, so I'm not surprised that they were concerned about this. And they just wanted to know if they would be accepted into the team or would they be seen as being an outsider. I think that's probably something that's common to anyone in any job moving into employment for the first time. So our conclusions from the study were that newly qualified nurses still experience transition shock, and this is despite decades of research and investment into frameworks and systems that are supposed to address this. We've known this for a long time. We just don't seem to be able to do anything about it. We think that offering multidisciplinary support is the best way to go forward. In other words, not just expecting the employers, or the employers not just expecting the universities to have done this, but for everyone to be involved and trying to instill a sense of confidence and competence and feelings of belonging in newly qualified nurses. And the ones who successfully manage it, and this is something that we did pick up from the interviews, no numerical data to back this up, but what we found was that the ones who successfully managed it were the ones who were looking forward to further challenges and to really doing the job and enjoying it. So whether we actually retain them or not, what we think we're doing, I may be talking a little bit beyond the results here, but what we think we're doing is at least we're retaining better nurses, not ones who are stressed and feeling left out. So the final report can be accessed at these sites. I'm quite happy to supply the PowerPoints to anyone who wants them, but you can Google Hull Star Nurse Project and you'll find the final report there. And it's a WordPress site, and you'll find other details about the project at that point. The outcome from the project, which remains to be tested fully, was a transition toolkit, and that's a URL to find that there. I'll give you an email address at the end of the presentation whereby you can make inquiries and get these links if you want. Now this is developed in collaboration with students, academics and clinicians. It's divided into 5 sections and it's got links to further information. This wasn't the full toolkit that was made available to the students during our study. That was very much in development, but we are now applying for a significant grant of about £400,000 from the National Institute for Health Research in the UK to test this transition toolkit in collaboration with other universities who also worked on Burdett Trust projects. So we're looking into having a first phase feasibility study funded by the end of this year. So beyond that, and from the toolkit, just to give you some examples very, very quickly, I'm not going to dwell on this too long, but we've got pages on the toolkit which give newly qualified nurses and students some ideas on how to be prepared, like making contact with the team they're going to be working with and looking for learning and development opportunities. We also have ideas for clinical staff, particularly formalising the arrangements for supporting newly qualified nurses, and some simple things that they need to address. Simple things like, where's the coffee room and do you know the code for the door? These are the sort of things that people need to know very early. They may be afraid to ask, so don't leave these things to chance. And we also have ideas for academic staff, and they're fairly straightforward, like working with the partners in the clinical practice and linking final placements to the transition of the newly qualified nurse into practice as part of the action plan. This seems to be the one thing that was commonly referred to and does seem to be very successful in easing transition, along with other ideas there. But this is all in the toolkit, and that toolkit has been made widely available through the United Kingdom National Health Service and through some other nursing organisations who have promoted it. So it is out there and available. Sadly, I can't answer any questions because I'm not actually with you because of the travelling restrictions that we're under at the moment. But I would advise you, if you do have any questions about the project and do want any more advice, then the sort of permanent anchor who's available to answer questions is Jane Ray, and her email is there, j.ray@hull.ac.uk. But those of you who know me and know my contact details are equally welcome to contact me. I hope that's been a useful overview of the STAR project. Thank you very much for listening.